Hello. Hello, I'm Dr. Sheetal Maru, and I'm here as the chair for panel 2. And I will introduce to you Dr. Mohamed Zurka and Dr. George Alouf here from Ghana. Welcome to this panel. And I would wish you could actually say a word or two, Dr. Mohammed.
As soon as I unmute myself. Can you hear me?
Yes, we can hear you, Doctor.
Good. Again, thank you, Dr. Sheetal. My name is Dr. Mohamed Zurka. I am the director of the Global Pharmaceutical Service Unit with International Medical Corps. International Medical Corps is a non-government organization, a non-profit, which is a preeminent first responder. We respond to all sorts of emergencies, from tsunamis to earthquakes to man-made and natural disasters all over the world. We've done that for the last 37 years with a little over 7,500 staff. And currently we're active in about 30 countries around the world. With that, I'll pass it to George.
I am not audible.
Yes, go ahead, George.
Yeah, good morning. My name is George Afo. I am a pharmacist and a public health specialist, working as a program manager for Med4All. Med4All is a highly digitalized pharmaceutical supply chain platform that seeks to ensure that quality medicines are made available and accessible in every part of Ghana. Med4All is one of the programs under Pharmacies. Pharmacies is a non-profit organization with a digital agenda. The core aim is to connect people everywhere, especially in the lower and middle income countries, to have access to quality health. So that is where I work as a program manager for Med4All.
Thank you, George. I will ask a few questions, in fact, one for each one of you. Dr. George Aful, can you tell us or give us some of the challenges for WHO's universal health coverage agenda, which is financing, and what are these financing options, solutions that are available to the African states?
Well, generally, with regards to the universal health coverage, there are a lot of prongs that has to do with coverage. In the first place, we are talking about having access to healthcare. The second is quality of the healthcare. And the third has to do with the availability of health technologies and health products like medicines. Generally, when you look at the African landscape, the various aspects of the environmental issues is such that it provides a lot of hindrances for people to have access to quality healthcare and to enable global achievement of the universal health coverage. In the first place, when you look at the African continent and in most parts of the lower and middle income countries, in the first place, the environment by way of conduciveness, peace, is sometimes not very much conducive. And therefore, even people coming in to invest in the pharmaceutical and the health sector is quite a little bit challenged. And it is also sometimes well known that in our part of the world, you realize that some leaders rather prefer investing in weapons rather than investing in health, so that people would have access to health and good health for that matter. So generally, when it comes to investment in Africa or in the lower and middle income countries like ours, this is where we expect that a lot of focus and attention will be directed to. Because without looking at the size and the market of Africa, looking at the population of Africa, if things are not done in a very pragmatic way to ensure that the population in Africa is carried along such that they will also have access to quality health, and that every barrier that is in the way to accessing quality health is removed, then it is most likely that the global agenda of achieving universal health coverage will be just a nightmare. One of the key things that we need to do is to form partnerships. One of the key things that we need to do is to ensure that technology is at its best. One of the key things that we also have to do is that we rally the various leaders in the African continent together to ensure that as part of their commitment to their people, they really put health high on their agenda. We also have to form more or less some form of advocacy team where they would advocate that every part of African continent and most parts of the lower and middle income countries, they really channel a sizable percentage of their income towards health, and that as much as possible, cost or financing should not be a barrier to accessing health. So the key issues that I want to sum up is that under the WHO initiative to ensure that health is assessed by every person everywhere, we need to ensure that barriers are removed. The barriers can be financial access, the barriers can be availability of the health service, it can be availability of healthcare products, it can be availability of health personnel, because the healthcare service as important as the personnel. If you provide flamboyant healthcare services and the personnel are not there to work in there is no way universal health coverage will be achieved. Then infrastructure-wise, we also have to ensure that traveling time to healthcare facilities are as short as possible, and that the traveling distance is also as short as possible. Sometimes maybe a distance between where a community is located and the nearest health post may be around, say, 5 kilometers, but the traveling time can take over 3 hours. And all this serves as important barriers to accessing health service, which also jeopardizes the global initiative to ensure that health is accessible by all people by the year 2030. So this is what I'll say for now.
Thank you, George. My question now goes to Dr. Mohamed Zurga. The drive for innovation in digital health may distract from other older, often non-digital solution. How do you suggest this transition is to be handled?
That is a very good question, very curious one, actually. In the field of pharmaceutical supply chain, as you know, some probably have seen it in our presentations, there are multitude of challenges, and we've talked about a little bit about e-pharmacy, and then how the digital era is transforming some of the health services that we provide to our patients. But in general, technology is here to stay. It's coming, fast and furious right now in different corners. There are a lot of innovations, but the way we create or the way we innovate has to always consider the users and the beneficiaries as well. All the stakeholders have to be on the table when we design this kind of softwares. Instead of just simply taking on what's available on the shelf or what's available on the market, it's usually a good idea to start building these softwares for purpose, basically involving actual users and stakeholders. So in our case, when we developed the pharmaceutical information management system, we involved basically all humanitarian actors that even at the fringes somehow get involved in the supply chain of pharmaceuticals. So we decided to involve doctors, nurses, prescribing doctors, prescribing nurses, pharmacists who were dispensing the medicine, logisticians who were catering for the procurement of these medicines, and the transporters. We saw all of the challenges, warehouse managers. So all of that really helped us design a simple software, but still adapts to existing systems without drastically changing the way we operate. So basically the software or the technology adapted to what we already have. With that, we made sure that not a lot of disruptions happen, and also the way pharmaceutical information management system, PIMS, this software was designed, helped us cut down the training curve. So easy to train. The ease of use was so unbelievable, because we designed it to adapt to the existing system. So we didn't change too much on the paperwork, on the paper trail. All of those paper trails are the same. They look exactly identical in the digital format. They can be printed, they can be exported. So people didn't find it to be totally new. The only difference is the efficiency, the speed of the work that they do, and also the security of the data and the ease of operation. So that really needs to be considered. So if you involve the right people at the onset of developing a software, definitely it really matters, and it makes a big difference.
Thank you, Dr. Zurka and Dr. Aful there, with your contributions on this subject. I would want to ask again, with the very little time that we have been left with. Is Africa on the road to sustainable development in terms of universal health coverage?
This is a very, very difficult question, because Africa generally is made up of many blocks, and the terrain at the various blocks are quite different. And therefore, it is very difficult to say that Africa is being moving as a block to a particular destination. But looking at what is happening in many parts of Africa, yes, Africa is putting up a lot of sustainable measures to ensure that its citizens have access to quality health, and that pharmaceutical supply chain system is also being improved. So in many parts of Africa, you realize that they are embracing technology and digitalization of the supply chain system of pharmaceuticals. This is in the bid to ensure that pharmaceuticals are made available at even the remotest parts of the various communities. Then you also realize that a lot of countries have started investing more in health. They are making, or they are partnering with other organizations to ensure that health is made more accessible, and health technology by way of pharmaceuticals are also being improved, because they have realized that when the gap is created, these gaps tends to be filled by counterfeit and substandard pharmaceuticals. And therefore, they are working with a lot of organizations, with other pharma industries and organizations who are promoting health to ensure that as much as possible, the gaps that exist now are being created, and that they work with credible partners to ensure that going into the future with having the universal health coverage in mind, they would work gradually and pragmatically to achieve universal health coverage. But that cannot be done by only Africans and the African leaders and its citizens. They need a lot of interventions and a lot of support from other communities. For instance, if you want to send, say, vaccines to some part of African countries and communities, even electricity is not there, and therefore getting cold chain to ensure that these pharmaceuticals are preserved, to ensure that its efficacy and potency are not reduced, is sometimes a challenge. And therefore, Africa is opening up, or is opening up to embrace partnership to ensure that every citizen within Africa in the various communities within every country do have access to good healthcare and good pharmaceuticals, which meet the international quality standards.
Thank you. Dr. Zurga, do you want to give a remark on that, some comments?
Yes, actually, towards the end there, I would like to add that there is a big need for a paradigm change. The paradigm about Africa or Asia, just generalizing, saying the problem of Africa or addressing Africa's health issues. Africa is, composed of about 57 countries now, and as George said, even if we talk about it in regions, the eastern parts of Africa or the Northern Africa or Sub-Saharan Africa, that doesn't even, service justice to what each individual country is doing. So I think it's time for us to really think and look at each and every country in Africa and address it separately, because every country has their own issues. There are some countries who are really successfully implementing health services, pharmaceutical services, because they have good infrastructure, relatively peaceful, and in a good development path. Others, while even they have some security issues, they're still cater to the needs of their population. So Africa is, it's not a country. So we need to really stop addressing Africa as such. If you just simply take Asia, for example, issues that are happening in Afghanistan are not happening in China or not happening in Indonesia. So if all these universal organizations, including UNICEF, WHO, or the UN systems, if they could just simply sit down and stop addressing Africa as a country, then probably we might make some changes in individual countries. That's probably just what I want to say on this point.
So thank you all. We are right on time, I believe, to close this session. Thank you, George Aful and Dr. Mohammed Zurga and the GRV team. Thank you so much. We meet soon. Thank you.